In 1963, Dr. Barry Blackwell received a strange letter. A pharmacist was asking if the severe headaches and hypertension his wife was suffering could be related to cheese. And he added, "No effects are caused by butter or milk. I hope this helps you with your investigations." Dr. Blackwell was skeptical. He couldn't believe that the side effects of the drug he was studying, Parnate or Tranylcypromine, were connected to cheese consumption. This drug was one of the first antidepressants ever discovered, a monoamine oxidase inhibitor. The monoamine oxidase enzyme breaks down dopamine, serotonin, and other neurotransmitters. If this enzyme is blocked by an inhibitor like tranylcypromine, the neurotransmitter concentrations increase, and we still don't know exactly why or how, but this produces changes in the brain that have an antidepressive effect. This is very good if you have depression. However, some patients, when taking this drug, they develop devastating headaches and hypertension, something known as a hypertensive crisis. Most of the time, the side effects stop on their own, but there was a chance that they could become more severe and end up in cardiac arrest, intracranial bleeding, or even death. To make things worse, this hypertensive crisis had a random nature. They could start at any moment. It didn't matter how many days the person had been taking the drug for, it didn't matter what dose of the drug was prescribed, they just started randomly. Dr. Blackwell was out of ideas. He couldn't figure out what was causing these issues. So when he received this weird letter saying that cheese was causing the headaches, he decided to test it. He decided to test it on his own body. Seriously, he started taking the antidepressants himself, together with another female colleague, so you can test both sexes. And after 1 week of taking the drug, they went to the hospital cafeteria and ate a high amount of cheddar. They measured their own blood pressure, but unfortunately, nothing happened. They didn't feel any side effects. This was discouraging, maybe they should have taken the drug for a longer time. I don't know, but he kept looking for an answer. Within the following weeks, he discovered 4 new patients taking tranylcypromine and having hypertensive crisis. The most remarkable case were 2 women sleeping on the same hospital room that developed severe headaches at the same time after eating cheese. After seeing this, Dr. Blackwell was fully convinced. Cheese was causing the headaches. But he still had to prove these findings to the whole medical community. So he decided to do a final experiment. Experiment that nowadays would probably be considered unethical. He took a female patient from the hospital, Mrs. Borrett, she was taking tranylcypromine as well, and asked her to eat cheese while he was measuring her blood pressure. Don't do this now, you will probably lose your medical license. But to be fair, it was 1963, there were not as many procedures as we have today. So it really looks like it was fine, there was no deception involved. He did explain to her that this was an experiment and the risk she was taking. It doesn't look like she was in a vulnerable position either. Her husband was there with her. So I think it was fairly okay for 1963 ethical standards. And I really mean this. There were many messed up experiments being done around the world in the 1960s, like the Dorset biological warfare experiments, where they used Navy ships to spray the bacteria Bacillus subtilis over the coast of South Dorset in the UK without the consent of the people living there. This was done to study the potential spread of biological weapons. Or even worse, the infamous Tuskegee experiment in the United States, where more than 400 black men with syphilis were left untreated on purpose. They didn't want to give them medicines for this fatal disease just because they wanted to study how syphilis spread among people. They lied to them for 40 years and more than 100 men died because of the experiment. It wasn't a secret study either, if you were wondering. The results were regularly published in medical journals for everyone around the world to read. I cannot tell you how bad this was. If this is the first time you hear about the Tuskegee experiment, you should at least Google it and do some research, learn about it a bit more. And if you have more time, there is a very, very good video by Dr. Joel Howell from the University of Michigan. He's a professor of the history of medicine, and he explains it very, very well, so you should have a look. But yeah, sorry to digress, but when the topic comes up, it's important to remember that these bad things were done in the past, and they are the reason why we have so many rules and procedures in clinical research. Nowadays, before conducting any experiment on humans, an ethics committee has to review your research proposal, and written informed consent has to be signed by all the participants in the study. Anyways, so going back to the tranylcypromine and headache story. So Dr. Blackwell continued with his bold experiment and gave 40 grams of cheese to Mrs. Borrett. For 2 hours, her blood pressure was stable, so the doctor just left the room to see other patients. But within 10 minutes of leaving, a nurse called him saying that Mrs. Borrett was having a headache. He rushed back to the room and found her having a hypertensive crisis. The crisis stopped on its own within 45 minutes without further complications, and the rest is history. That's the final proof he needed. Dr. Blackwell published his findings in The Lancet, and within a few months, all doctors in the world knew how to avoid these side effects. Up until this time, there had been 40 patients dead because of this lethal interaction between cheese and monoamine oxidase inhibitors. So there were quite a few lives that were saved because of this research. At the end, scientists figured out that tyramine from cheese was causing these side effects. As you can see, tyramine is a molecule very similar to dopamine, adrenaline, and noradrenaline. Because of these structural similarities to neurotransmitters, tyramine can have many different pharmacological effects. One of them is raising your blood pressure, something known as the pressor response. Usually, there is a low amount of tyramine in our diet, although some foods, like cheese, have a high concentration. But it doesn't really matter how much tyramine we are eating, because our body naturally removes it by using the monoamine oxidase enzyme, so we don't feel any side effects. But if you are taking a monoamine oxidase inhibitor, and on top of that you eat food with lots of tyramine, like cheese, then you can get a hypertensive crisis. This side effect made monoamine oxidase inhibitors lose their good reputation. Nowadays, it's very rare to find a doctor prescribing them. Other antidepressants, like SSRIs, have become the first choice medicine for depression. This is not the end of the story though, because some professionals claim that the side effects of monoamine oxidase inhibitors have been exaggerated, and we should be using them more often in clinical practice. They are serious about this. They have created the International MAOI Expert Group, which last year published this beautiful prescriber's guide to classic MAOIs for treatment-resistant depression. There are some good reasons to consider their position. For example, our food now has less tyramine than in the 1960s. Thanks to modern food hygiene standards, even cheese has less tyramine now. Monoamine oxidase inhibitors are indeed effective medicines, so maybe we can go back to using them in specific patients that need them. Another thing that really surprised me to learn is that if you combine a monoamine oxidase inhibitor with a norepinephrine reuptake inhibitor, the tyramine effect on blood pressure can completely disappear. And I'm not saying that you should mix these medicines or that doctors should prescribe them. No. What I'm saying is that it's surprising that there are no pharmaceutical companies researching the combination of these two drugs. Why is it surprising? Well, because when you combine two existing drugs, that is like making a new medicine, and you can patent that and make lots of money. So yeah guys, if you happen to own a pharmaceutical company with a few $1 million to spare, maybe you should look into this. It could be a very, very good investment.